Hey, you may have heard of fasting blood sugar, or FBS, or fasting blood glucose, as a measure drawn by blood and examined for how well we process sugar, for how well our insulin is working, how well our system is able to utilize sugar as a fuel source. What you may not be so familiar with is that there's a protocol where we ask patients to be fasted 8, maximum 12 hours, usually about 8 to 10 hours, right before you have this blood extraction taken. What's usually misunderstood is when you say fasting, most blood extractors, most medical technologists, the phlebotomists, people who draw your blood, most will tell you that you should not have had anything by mouth, including water. And recently I had a patient who ended up having a really bad throat because she got so dehydrated because she really made it a point that she had absolutely no water. That was really difficult for her, and she's got a bum throat right now because of that. You see, what's left out is that you can have a bit of water. The instructions are usually made to be absolute, meaning you're supposed to take nothing, including water, at all. Okay? Because of what can happen with a large amount of water, like if you take 1.2 liters, and for some patients, if you take beyond like a glass full, that can throw off the fasting blood sugar results. But if you take just a bit of it, just a bit to wet your mouth, just a bit to quench really bad thirst, like within and under 200 ml, so like 50 to 200 ml, that's the bottom of your whiskey glass. If you take that amount of water just to quench your thirst, it doesn't throw off blood sugar results so bad. Now, the parameters are in place so that people don't mess with the results, because most people have really poor impulse control and will end up taking much more water than that, and that'll throw off the results. But to a properly informed patient, taking just a bit of water just to make sure they don't collapse on you and that they can still speak around the time you take you take their blood for examination, just a little bit of water is fine. Okay, but it's, if your medical technologist just memorized the protocol and didn't understand why the protocol is that way, and can't take the time to instruct patients properly beforehand as to the parameters, and is unable to spend time with the patient to figure out, is this a personality, this is the kind of person who, if you give them very specific instructions, they can do that, or can you instruct the caregiver properly? If that can't be done, and the poorer you understand why you're doing something, if you just memorize something, well, the leeway is very small. If you don't understand how something works, it's very difficult to go around the rules. Okay, and the clearer, the better, the more thoroughly you understand how things work, the better things work, and the more you can find your way around them. Hope this helps. Cheers.